A question we get asked a lot is it worth it for a general dentist to get a microscope? Now this question is a lot more relevant now that we have an affordable microscope around the 10k mark without having to compromise on the optics, the clarity or the magnification. Whereas previous to this, it would be much harder for a general dentist to justify spending 40k and upwards on a microscope. There's obviously a bit of a learning curve getting used to the microscope, but when this is achieved, there's many benefits. A big advantage is the ergonomics and the strain that it takes off the neck and the back. So they allow a dentist to sit in a natural posture without having to constantly bend over and assume an unnatural position, which can be very uncomfortable at the time and lead to long-term problems. So there are many situations where the improved visualization and magnification of a microscope can help a general dentist in their day-to-day practice. Dr. Michael Wenzel is a general dentist who uses a microscope every day. And in this next clip, he talks about some of the situations in which he likes using the microscope.
The first reason is that you need or want to work more comfortably. I say need because there are clinicians out there who have literally stopped practicing dentistry, and the only way they were able to get back into it was through use of the microscope and the ergonomic benefits that it's provided. Once you do master the scope, the ergonomic benefits are unparalleled, and it's amazing how comfortable you can be while at work. Reason number two is that you want to see better. Whether for endo or restorative, there's no doubt that a microscope will help you see better. The question is, does this improved visualization actually translate to better clinical outcomes? I don't have a study that is going to confirm or deny this for you. I don't even know if there are those type of studies out there on the dental microscope. But after having used the scope for about 5 years, I can just think of so many examples of little subtle mistakes that I wouldn't have caught if it wasn't for the enhanced visualization and magnification of the microscope. So little things, just like matrix bands not being properly sealed to the gingival floor of a proximal box, especially in those deeper proximal boxes. It's amazing how it looks sealed at 2.5 times magnification, but as soon as you turn it up to a little bit higher, you can really see that there's a gap there and that fluid is creeping in while you're trying to fill that tooth. Other aspects of practice just become so much easier. For example, caries removal becomes even more straightforward as you start to associate the high magnification appearance of caries relative to that of affected dentin and healthy dentin. And to be honest, getting a clean margin when doing a crown prep, even when prepping subgingivally, is just so much less of a hassle because there are effectively zero shadows in the visual field while prepping under the scope. The ability to take video and photo on the fly also makes it so easy to explain to patients when they have a dental problem. It's one thing to tell a patient their tooth is weak and that they need a crown. It's entirely another to let them see the crack at 16 times magnification, which is threatening to split their tooth. I do about 99% of my checkups through the scope. We've installed a monitor on the ceiling with a live feed from the microscope, so patients can actually see exactly what I'm looking at. It's rare to have a patient not book for treatment once they've felt and simultaneously seen an explorer get stuck inside one of their cavities at high magnification. On top of that, insurance approvals are just so much easier. So for example, when you're prepping a tooth and you take an old amalgam out and you see a giant crack running across the tooth, it's so much easier to communicate that to the insurance company with a great high magnification picture. So this is really where the ROI comes in. You can really convince people that the treatment that you're recommending to them is actually worthwhile, because not only are you telling them they need a crown, but you're actually showing them the problem and helping them understand on a very kind of visceral level what is going on with their tooth and why something needs to be done. Even if I couldn't document cases or take photos, I still wouldn't want to practice without my scopes. The ergonomics and enhanced visualization alone make the scopes worth their weight in gold.
So Dr. Glenn Vanas is also a general dentist and an avid microscope user, and he talks about the advantages of being able to show your patients what's happening and how it helps when explaining to patients the procedures that he's recommending.
The third thing that I find is that with communication it improves. We have a monitor here for the assistant to be able to see, so she can see firsthand what I'm doing with the microscope. And I can communicate without actually having to speak. She can anticipate what's next. And I can communicate through photos and video with the patients to show them the cracks. That brings me to the final advantage, the fourth advantage after ergonomics and precision and communication is your documentation. We have a SLR camera here, and on the other side we have a video camera. And through video and stills, we're able to document our cases for insurance purposes, for publishing, for just patient education. We're able to document in real time what's going on, and they're able to watch on the television up above what I'm doing and get an understanding of the precision and the expertise that's involved in their treatment.